way up to 400% of the federal poverty level would qualify for some kind of tax credit. The lower income, if you're making no more than 250% of the federal poverty level, and that's why I've got those, the table outside on the, or the flyer outside on the table. If you're making no more than 250% of federal poverty level, you will also get help bringing down co-pays, deductibles, and out-of-pocket maximums. And we're seeing on some families, we're seeing these $2,500 deductibles come all the way down to $750. And when the median household income in Union County is just under $41,000, we're seeing lots of families qualifying for this financial assistance, okay? So it's been real interesting. I want to speak to the out-of-pocket maximums on the plan. The Act is full of several consumer protections, okay? Bringing down out-of-pocket maximums, eliminating all the internal limits to various benefits. All the protections in the Act refer only, however, to the benefits on an in-network. You know, every health insurance plan has benefits in-network or preferred providers and out-of-network. Those docs that do not have contracts with the insurance company. All the benefits or all the restrictions go to in-network, and the most any person could be out of pocket is $6,350, $6,350. So if you ended up in surgery with a $50,000 bill, the most you're going to pay out is $6,350. Okay, that means all of those $7,500 and $10,000 deductibles that are on the market right now are disappearing because that's over the $6,350. Okay, so but when you take these out of pocket, there's a whole bunch out there. I have clients on that are $12,000, $15,000 out of pocket, and you bring it down to $6,350, you cut it in half. Yeah, there's a rate impact to that because the plan's a better plan. You got to be aware of those benefits out of network because the companies all did a little something different, and some got way too high in my mind. But anyway, so lots of changes going on. We're trying to run as many people through Cover Oregon as possible. Our hands are a little tight, we're handicapped because the website isn't working the way we'd like it to work. But I think that gives you an idea. I could talk forever, and I'm going to stop there. And I'm going to hand over to Lisa.
Okay. Can you hear me all right, or would you like me to use the microphone? Okay. So this is all very confusing. My name is Lisa Lagendorf, and I'm with the Northeast Oregon Network. We're a nonprofit health collaborative working in Union, Baker, and Wallowa counties. And our mission is to assure access to and quality of integrated health care for all residents. Towards that end, we have involvement in a number of different aspects of healthcare reform, working with both state government, statewide partners, local healthcare providers, social service agencies, and the public. And what I would say is that healthcare reform today is a very, very confusing prospect. It's very challenging to understand. One of the reasons for that is that healthcare has got to be probably one of the most broken sectors in our public and private corporate life that you can see today. Highly expensive, highly broken in the sense that there's a lot of research going into it without the desired outcome visible. One of the things that our organization really strives to do, and we have a couple beliefs, and one is that action is, in most cases, better than inaction. So attempting to solve problems will get us further than not attempting to solve problems. And the second is that there's a lot of power in local communities. And that's really one of the things that we work with our communities to do, is say, okay, what are the potential solutions in front of us now? And the potential solutions that we're looking at today might not be the same solutions that we're looking at 3, 5, or 6 years down the road. Not only is change messy, it's stepwise. So what we have today with the the ACA, the Affordable Care Act, will have improvements for many people over what has previously been there. It's also very clear for those of us that are working in the weeds on it every day that it's not the final solution that's going to be a good solution for our communities and the individuals in them either. So it takes all parts and all folks across the sector of the community, those who are out in front working on the ultimate change, and those who are working to help our communities benefit from the changes that we have now. And that's one of the things that we've appreciated with our partnership with ORA, is the ability to do that. So our organization is how we connect and relate to the Cover Oregon piece is we are a community partner grantee. We have a one-year grant from the state of Oregon that allows us to hire staff that are on the ground in Union, Baker, and Wallowa counties to provide free assistance at no charge to community members to help navigate the Cover Oregon enrollment and assistance process. We only have this funding for 1 year, and so we're trying to get to people as fast as we can to get as many folks as we can in that period of time. The enrollment process, as Beth pointed out, there are many changes and there are many benefits to many individuals. It's not a simple process, as anyone who's been involved with it knows. We're learning rapidly about all the details of it. And right now, you do need to have someone help assist you with the application. There are certified agents in the community. Beth and her agency is one of those who can assist you. There are community partner grantee staff, such as our organization, and many providers, such as the hospital and a few of the doctor's offices, also have folks trained in helping assist people. One of the things that Northeast Oregon Network does is we do community health assessments. And the last assessment information from our hospitals indicated that 21% of the folks going through the emergency room in our 3 counties were uninsured. And the emergency room numbers are considered to be a pretty good indication of a profile of the need of the uninsured in the population. So we're looking at roughly 21% that are uninsured in our 3 counties. On surveys that we've done with a wide number of folks in our counties, we have about an equal number that are what we might consider to be uninsured. They have the $5,000, $8,000, $10,000, $12,000 deductibles, which effectively mean they can't go to their doctor on a daily basis. They can't afford to do that. So we're really looking at a huge number of our population that could potentially benefit from some of these changes in the ACA right now. We have, Eric, can you raise your hand? Eric Griffith is here. He's one of our community assisters. He's one of the staff that we have that's available to sit down with folks for an appointment, go through the application process, help answer the questions. And what we do is help folks get through the enrollment piece. When it comes back to you, what coverage, what plans you may be eligible for, and what your subsidies are. At that point, folks can say, I want this particular plan, and I know I want it, and they can choose it. Or folks might say, how do I decide which plan to choose? That's the point where we refer someone to a certified agent, where they will have details about in-network and out-of-network and all those details. Like we said, one of the things about these ACA improvements, which can make things better, but still a drawback, is they're very complicated, and an ideal solution would not be this complicated to navigate. However, while folks like ORA and Healthcare for All are working on long-run solutions, there are folks like Beth and myself who are trying to help our local community take advantage of what benefits there are now. So please see Eric or myself if you would like an appointment. He's got brochures, he's got a sign-up sheet where folks are interested. We can call you back, and we encourage you we're available to come, like Beth, to come speak at any community meetings or gatherings, and we encourage all of you to take information and brochures to give to your friends. Because the most important thing is currently with the ACA, it is currently the approved legislative solution, and while it's an incomplete one, All of our taxpayer dollars are going to it, and it's our determination that our local community members will see what benefit they can right from.
I have a question. You said you have a question?
Just to start off, I want to break the ice here.
Okay.
All questions should be encouraged. Nothing's off the table. But how does help out? But you're obviously very knowledgeable and skilled. I was curious. It occurred to me while I was listening to you. How many hours of in-service training have you had to go through to get to this point? This job.
Well, the certified agents only had to go through an 8-hour day to learn about cover Oregon. One day, but no, but for cover Oregon. No, that's just studying on your own, and I couldn't count the hours. It's countless.
Sure, that's what I was going to do. Who has a question? Any question?
I don't need a microphone.
Okay.
Yeah. My voice carries.
Yeah.
Beth, I had a question on Plan B. Is that the one where you have to manually basically print off a copy, fill it out, and send it in?
Yes, although you don't have to print out a copy, but it's kind of a nice worksheet. But if you go to the main website in the coveroregon.com, and on the home page down to the bottom left says Get Started. And it says fill out the paper application. If you click on that, it's going to take you through a few instructions, and there's 2 options now at the bottom of those instructions. If you want to apply with financial assistance, or you want to apply to Cover Oregon knowing you don't qualify for financial assistance. That's a much shorter application. But you can fill it in online. You have 3 hours to complete it. It's not taking, it's taking us about 25 minutes, depending on how large your family is. But once you submit it, well, and you can't save it, so that's why I suggest you might want to work on it in a worksheet. But we're having a tough time getting through the faxes to Cover Oregon because they're overloaded. So I would go online, fill it out best you can, make sure you print it before you hit that submit button, because once it's gone, it's gone.
It's a PDF.
It's a PDF, a fillable PDF.
And it's really helpful, what can help make that go more quickly is if you have all of the information already there in your head. So if you know how much you pay for IRA contributions, and how much you pay for this, how much you pay for that. So that's one of the things, that checking out the application first before you go in to fill it out, to make sure that you know all the questions they're going to ask you. Because that's the thing that typically takes a long time, is if you don't know. And you don't want to guess, because you're certifying that this is your best estimate, and if you happen to be really wrong, there will be some adjustments later in the year that you might not like.
Well, and two, what's nice is once Cover Oregon is completely up and running properly, you're doing your best to project your 2014 income. Okay? Some people know exactly what they're going to have. Farmers and ranchers, they know. So you're going to put in your best guess. And then, later on in the year, if you're wrong, and all of a sudden your income's much lower or higher, you can log back into Cover Oregon, adjust your income, which means the tax credits will adjust the following month. Because the whole idea is it all accrues up at tax time at the end of the year. And the whole idea is try not to have to pay back a whole bunch of those tax credits. Yeah. So you can adjust.
Something just came up. You mentioned that you had to know what your IRA. So if you're paying into an IRA or any other kind of a retirement plan on your own, that just like your tax return, it lowers your income.
Yeah.
And then
Pretty much if you have your tax return in front of you, most of the categories of what you need to fill out on your tax return as deductible, not all of it, but a lot of it will be in the income section. So it's a really good idea to have your tax return and have some idea of what, if you're going to be the same as last year, it's easy. If you're not, then you need to have some idea.
Because they have various categories of income, wages versus social
Right.
security.